All right, good evening, everyone. We're just going to let some people to sort of trickle in for the next 5 minutes, but we're going to start the meeting in about 6:35.
We have a hand raised from Lisa, so I'm just going to allow her mic really quickly to ask a question, and then before we start. Good with that?
Sure.
Lisa, how can we help you?
I love early audience participation.
See if we can hear from her. Lisa, we saw your hand raised. Is there anything we can help you with?
Maybe it was an accidental hand raise.
Could be. I've done that before.
Couple more minutes. Some people are still trickling in. All right, I think we're going to get going. Dr. Hunter, are you ready? Dr. Hunter, are you still there? I can't hear you.
I'm here.
Oh, there we go.
Okay. There you go. Yep, sorry. Need to get a water.
No, you're fine. You're fine. Of course, my heart just sank, but that's okay. We lost the speaker. All right. Everybody, thank you for taking time in your schedule to join us this evening. This is the fourth edition of our webinar series that we've been doing at Selling Biosciences. My name is Gregory Benedetto. I've been with Selling now for about 8 years. I've done many roles with them, and one of my roles here is education and sort of, helping people understand what it is that we do. We are a diversified company that has 3 arms. We have a aesthetics division that deals with radio frequency. We have a spine hardware division, for implants, for spinal fusions and things of that nature. And then we have a biologics division, which is really what we're going to be speaking to tonight. When we encompass biologics, we're talking about autologous biologics, blood that comes from that patient, that particular patient that we manipulate, and then we implant it back into the body to help the body heal. It's amazing science. It's got a great track record, and that's what Dr. Hunter is here to talk about this evening. And I'm very excited to have Dr. Hunter with us. He is one of our most accomplished, if not the most accomplished, spine surgeon that we have the privilege of working with. He has a medical degree from Georgetown Medical School. He is an assistant professor at Wisconsin. He has 26 years of brain and spine surgery experience, which is just incredible. The volume of cases he has worked on, and the amount of knowledge he has. He's an incredible doctor. He's also an incredible businessman. The second half of our talk, we're going to talk about Dr. Hunter's business, where he practices regenerative medicine, and it's really just a privilege to be able to pick his brain for the time that we have him. So the way that this works is that Dr. Hunter is going to introduce himself and what he does and how he incorporates biologics into his practice. We encourage participation from the audience. So if you want to type in questions, we'll stop him. We'll talk about them. Please, feel free to ask anything that's on your mind, because I think this is a fun subject to talk about, and there's really a lot that's going to be going on tonight. So without further ado, Dr. William Hunter, thank you so much for being here, and the floor is yours.
Greg, I want to thank you and Selling for having me the opportunity to come and speak tonight. Excited about the opportunity. I mean, I really love what I do, and I'm very passionate about the things that I want to accomplish, and certainly for a long time, more than a decade plus, we've been working together to make this reality happen. And I think if I'm able to do what I can do, I'm helping patients out. So I mean, I think in the grand scheme of things, that's what it's all about. With regards to surgeries.
And Dr. Hunter, I'm sorry, I didn't mean to cut you off, but I do want to mention to everybody that Dr. Hunter has been practicing regenerative medicine since 2010. He's been working with Selling since 2015, but I mean, his knowledge in neurosurgery and his knowledge in regenerative medicine is just unmatched. And I would be remiss if I didn't mention that before he started. Please go ahead.
Thanks, Greg. The first slide, talks about spinal fusions, and this article is actually very near and dear to my heart, because back in 1998 was the first time I was able to actually start on my own and hang my own shingle. And so since 1998, I've been performing spinal fusions, and there have been so many advancements in spinal surgery. It just seems to coming every year, there's something new, and it's important for surgeons to learn the new techniques. It's important for us to not do the things that we did back in residency, back in the early 90s, but actually do what we're doing right now in 2024 and beyond. And that's what this is all about. It's really having the opportunity to continue to learn, on my end of things. And I have performed a lot of surgeries, a lot of lumbar surgeries, lower back surgeries, as well as neck surgeries. So I really feel that I've had an opportunity to really understand and learn and grow and help the patients. I think in the grand scheme of things, there's a couple different strategies to help with the advancement of spinal fusions. The first is the hardware, the screws and rods that we put in. The things that we have now are much more able to accomplish our goals, using the latest and greatest techniques with GPS computer guidance systems, which are connected to the screws and rods that we have, the different materials, whether there are PEEK or titanium or even a coating is important. And also another strategy which sometimes gets overlooked is the biologics. And I think that's where Selling has just been on the forefront with regards to being able to help with the fusion, because one part of it is aligning the anatomy and keeping the anatomy aligned. And that's part one that we do when we go ahead and place the screws and rods in place. Then part two is to allow that fusion to occur, and then also allow that to be stable. And if we accomplish those goals, then it's going to help the patient. And I think that's where the advantage, is all about. I think the advantage that selling has is that they've been able to marry the biologics and able to come up with a system that is FDA approved, that is safe, and more importantly, that's reproducible in the OR very easily. The little circles there basically mirror up the BMAC, which is the bone marrow aspirate, as well as the matrix and the growth factors. And once we piece all that together, we're then able to come up with a system that's going to allow a better fusion. And if there's a better fusion, it's going to help the patient overall. And I think that's what's important to understand.
Dr. Hunter, we have our first question.
Yes, sir.
Somebody wants to know what your experience with other biologics have been, and where do you see the evolution of biologics going?
That's a great question. I think in the grand scheme of things, because I've been using different products since 1998, I've seen a myriad of technology that's out there, and I've tried a myriad of technology, and certainly being able to come up with and see what the advantages are that selling has is important. I think the struggles is going to be, how are we going to get paid from the standpoint of the insurance plans and the hospitals. I think that's the problem, that everyone is having technology. The technology is continuing to grow every 6 months. There's new technology out there, and technology costs money to perform. And so all the technology, having a GPS computer guidance system, a robotic system, these are all systems that we currently use right now in 2024, and the most advanced bio matrix that we can have for biologics, and yet it costs a lot of money. So I think there's going to have to be a way at which cutting the costs are going to be what's important in the grand scheme of things. So I think there's going to be continued advancements. There's no question. And once you have the technology, then it's easier to advance that technology to newer and improved systems. And if you see selling, that's what they've had for the past 10, 12 years that I've seen that company grow with the technology that they have. So right now they have, bar none, the best product in the country, if not worldwide, with regards to having the ability to allow this bone marrow aspirate, this matrix, allowing to connect with the growth factors to allow a fusion to occur.
Yeah, and by far, I mean, I really, I think it's the safest. I think that's always something that we hammer home.
Yeah. I think that there's no question. And when we look at it, the bone marrow concentration, we're able to do that in the operating room, and I've done thousands and thousands of these where we can go ahead and take a trocar and get into the bone marrow and use that to put it into the system. ART BMC Plus is bar none, an FDA approved system that allows a significant concentration of the growth factors, of the proteins, of the enzymes. And then when you mirror that up with the matrix, it allows this, conglomerate to go ahead and allow a fusion to occur. And it's all about the fusion, right? You know, we want to make sure that we do our job as far as freeing up the nerves. It's important, getting it into position where we want it to position, look at all our numbers to make sure all our numbers are calculated correctly. And then once we do that, we go ahead and place the screws and rods in place and allow that, but then to add the biologics, to use this ART BMC Plus, which is, you know, a safe product, like you mentioned, Greg. We're able to reproducibly do it. So I mean, I've done thousands of these, you know, and I'll talk later. Not only do I do this in the operating room, but I also do it in my office, you know, under local, where there's no anesthesia associated other than just local, you know, medication in that area, that we're allowed to obtain, you know, the highest stem cell productivity, which is in the bone marrow. And that allows us to use that uh, matrix to go ahead and place it into the BMC Plus system. And then that's where it allows it to, one of a kind system, to concentrate the highest of the growth factors and proteins. So, and then with this, you know, system, you can see that it all of a sudden, and I don't want to get bogged down in the numbers, but the numbers, the bottom line basically shows all the numbers are higher. And so we want the, you know, VEGF to be as high as it can be. We want the cytokines, the proteins, to be as high as they are, because that means it's going to give the ability to the fusion to occur. We want inflammation in that area to allow the body to turn around and say, okay, it's a factory now. Our job is to go ahead and fuse the area that we needed to fuse, to allow that to kind of use, so that the patient will ultimately improve in the condition. And we do this on a daily basis. And like you said, Greg, it's safe, it's clearly safe and reproducible, which is effective. With that, you know, the regenerative cells and growth factors, there's a lot of advantages that it brings to the environment of that area. It allows collagen synthesis. It allows wound healing. I mean, there's so many things that can improve the proliferation of the fusion, which is all important. And this is the same material that I even use, you know, in my regenerative medicine clinic, where we do as an outpatient, where we take all of this technology and then place this into a joint, where it might be, you might have a knee joint that's not doing so well because of a cartilage or a torn ligament, and you can go ahead and inject that material, and then allows that environment to improve overall. So I think the key is to allow a fusion to occur. And you know, this is one of the early X-rays that we got, and I initially started this internationally. We weren't using this in the U.S. So back in the early 2000s, we were doing this, you know, internationally. And then around 2013, we started using this in one of the surgery centers in Europe. And you know, it was interesting, you know, again, and learning from me, for learning a tool for myself, when I'm operating on you know, patients from the Middle East, even physicians that came over that wanted an operation. You know, these were, you know, overweight, diabetic, and smokers, you know, which is the worst of the worst, right? And, you know, right now in the US, when we try to perform a fusion surgery, you know, patients that are smoking, the insurance companies say you can't do their operation. You have to have them stop for a handful of months before you can actually do the surgery. So even in the worst of the worst patients in Europe, where we took this technology, we were able to go ahead and get a phenomenal type fusion, which again then translates into, you know, that system not moving, the nerves are nice and free, and that patient gets relief.
Dr. Arnott, I have a question, a personal question.
Yes,
and
sir.
If you can't comment on it, because it's kind of tough for you, maybe you to think that, but so for me, you know, when I'm preaching bone marrow and using bone marrow, augmenting the surgery with it, it's not only about, treating the joint space now, which has been breaking down for years anyway, but it's about also preventing the next surgery. So adjacent segment disease in the spine, for example, or total knee reconstruction for someone that's had an ACL surgery. Over your time, this is, oh man, I'll be, if you don't know, it's okay. But can you comment on how many, when earlier in your career, maybe how often you would see patients for that second surgery versus how often maybe you see them now? And with patient follow-up and everything in your career, it's got to be hard, but I'm just curious. I know that's a tough one.
No, it's a good question, and the literature's out there, right? And it talks about, there's a certain percentage at about 5 to 7 years. I think they're quoting anywhere from 10 to 14% from what I remember, all the literature that's out there now, and that there's adjacent level disease, which is basically, Greg, what you're talking about is if we're operating on one level, and it might be a domino effect. That's how I kind of describe it, to where the next level might all of a sudden break down. It happens. It even happens nowadays. But I think nowadays it happens less often than what it was back when I was doing this in 98 or in 2000 or 2005. Certainly the technology is better on both arms. I think the technology of implantation of the screws and rods, because where we were placing screws and rods at the joint, which is the next joint above, would all of a sudden artificially break down. So we were almost causing that to break down as time went on. So I think the placement of the joint, and then I think the biologics. I mean, now that there is, the biologics are much more robust. I think it's allowing that area to fuse, quicker, and then keeping the nerves in place. And I think also I have to admit physical therapy. I think something that we don't overlook, I think patients sometimes overlook or don't want to do. Physical therapy is vital to undergo improvement, whether that's before surgery or after surgery. If there's a way I can keep people away from the operating room, that's the way to go, right? We don't want to do a surgery. But if you have to have a surgery, if they get to a point where they cry uncle and they say, I can't take this anymore, I've got back, hip, leg pain, I've got all these issues, I've got a bad back, my family history is back problems, then we have to do the operation. But I think we have to do it, systematically. I think we've got to think about what we're doing, what our goals are, what our goals for the patients might be, and what the patient's goals are. And then I think the factor of where we're putting the screws and rods and how we're putting them in nowadays. Nowadays, with all the, robotic systems and the GPS guidance systems, it's night and day compared to what I was doing back in 98 and 2000, even 2005. And again, with the biologics that you guys have perfected, I think that has only added to the improvement of the decreased number of percentages of that domino effect that patients have.
Amazing. Thank you.
Yeah.
I have another question that's typed in here. They want to know if you've seen any sort of pain mitigating effects. So, i.e., are your patients taking any less pain meds after using biologics like stem cells or regenerative cells, excuse me?
I think in my fusion surgery, I would probably say not. I don't think it's related to the biologics. In other than it's we've been able to fuse the patient, so that's good. We've been able to decompress the area, that's good. There's no question patients that need that operation because they're unstable, and they need to have screws and rods put in, and then we kind of can put those factors in there and the screws lock it down. I think they will get better. There's no question. Clearly, with my regenerative medicine clinic, there's no question. I mean, patients are taking less and less pain medication, doing better, and they're trying to get back into their life, right? And the regenerative medicine clinic patients are the ones that we're trying to keep away from surgery, whether that's a knee operation like you had mentioned before, or a hip or a shoulder, or even a spine operation, that I do. So I with my regenerative medicine clinic, I do more than just the spine, because I've noticed that with those factors that we talked about earlier on how it heals things, my thought process was, hey, let's take this to the next level. Let's do this on all the joints, and let me, learn and go get some knowledge on how to do these injections in the joints, and then kind of go from there. So, I did some extra training, so that I can kind of learn that. I knew how to take the bone marrow aspirate. I knew how to use the system. I knew how to do all that. Now I've got, the gold as far as the healing process. Now I just need to deliver that into the knee. As a brain and spine surgeon, I don't really operate on the knee, but I was able to learn on how to inject into the knee, into the shoulder, into the wrist and elbows and ankles, as well as the spine. So I think, to answer a long answer, and I'm sorry about that, but I think, the material certainly helps, with regards to the regenerative medicine, on decreasing the pain medication, because people don't want to take pain medicine. I mean, we see patients every day that need pain medicine, but their goal is not to take pain medicine. It does make them feel good. They get nauseous, they get dizzy, they can't function normally, they might be on muscle relaxants, and that combination is always a hard problem. So we want to get patients off of pain medication, and if they can just go to over-the-counter stuff, that's great, or maybe not even anything. They would take that in a heartbeat, and then also, get better and improve so they can get back into their life, whatever they want to do. I mean, so I think from that standpoint, I think we have that ability. So I think, from the spine fusion standpoint of my practice, being able to deliver better technology is the key. I mean, I grew up where we had, house phones and long cords and things like that. Now we have an iPhone or a Google phone that can basically tell me what's going on in the world, without me even needing to leave my house. And so the same with spinal fusions, or just spine in general. The technology has grown and blossomed so much that, there's improvement. And if there's improvement on the delivery, whether that's the delivery of better screws and rods, whether that's the delivery of better biologics, it's only going to improve the patient overall outcome. And that's what we're looking for. We're looking for, if the patient has to do surgery, let's get the best outcome we can get. And I think that, going to someone who's been doing it for a while and learning and continuing to grow and want to do this, I think is important. So we're able to use, the product that's FDA approved, that's certainly cost effective, and the highest efficacy it could be, than anyone that has that's out there. And I've used all the other systems that are out there, and bar none, your system still is the best one that's out there. So,
well, thank you for that. And the literature definitely says that the pain mitigating factors from bone marrow, the growth factors within there, are essential for, mitigating pain, releasing that pain. So, the technology is twofold. It's concentrating the cells, and it's obtaining growth factors. So,
yeah, and I think with that, I mean, that's where it kind of alerted me to say, gosh, I see these patients, and I might see, 9 or 10 patients. Only 2 of them really need an operation. So of the 9 or 10, that's only 2. Maybe 3 of them, there's really nothing I can do. There's nothing on the MRIs. There's nothing that's there. But there's a good 5 or 6 patients that have a problem. It might not be bad enough for a surgery, but certainly they can't live like this. And I was having a really a look-see under the hood for me. What can I do with these patients? And that's where, I kind of looked into the regenerative medicine side of things, where I want to try to promote as much I can with regards to health and wellness. And if there's a way to somehow improve their quality of life. And I think being able to use this system into the other joints, it's going to help. So if there's a few patients that get better with surgery, a few patients that can't do anything, there's a lot more patients that there is something we can do that can improve in their situation. So that's why we started up the regenerative medicine clinic, so that we could kind of help in that. And in doing that, we use the applications of the biologics. So your, gold standard across the country and around the world is we're using that now, even in our regenerative center, clinic, so that we can, get some bone marrow aspirate when the patient's there in the office, harvest it right there. And it used to be with other systems, it might take a few hours for this to happen. We're only talking minutes now with your system. So it's a safe procedure to do. It's in the office. It only takes a few minutes. We can then concentrate down like that big number, all those numbers that was on that bottom line. So we're able to give the maximum amount of biologics into an area that's striving to improve and striving to get better. And if there's a way in which we can deliver that, and then it can kind of be an orchestra to kind of deliver all the other cytokines and enzymes and proteins to get into that joint and help heal that joint, patient's going to get better. And that's what we found. I mean, we found it again and again and again. And I was fortunate enough to meet up. And one of the earlier slides, I have to tip my hat off to Dr. Hernigu, who has had, I think, 30 plus years, maybe 40, with regards to regenerative medicine. He's in Paris, France, and able to go there and spend some time with him and really see what they do. That really opened my eyes to the ability of maybe using this technology here in the United States. For the biologic ends and for the regenerative medicine side of things. So able to, help with the healing of the joint. And I think that's what's important. And what joints are you talking about? You're talking about elbows and knees and facets of the spine. And I think from that standpoint, that's what's important because, it's something that we can do in the clinic in a matter of minutes to where we can aspirate, concentrate, inject, and then kind of go from there. Now, it's not an immediate improvement. Patients don't all of a sudden jump off the floor and they're doing splits and they're feeling great. What I've noticed in my practice is that there's typically about a 3-week improvements, around the 3-week mark. People start noticing there's something. And then really around the 3-month mark, people are starting to get better. And actually the literature talks about, Dr. Henry keeps on telling me, it's 6 months before you really start seeing, the effects of everything. And that's what's bearing, what we're finding in the clinic as well. So I think from that standpoint, it works. And there's a ton of scientific information, that works, that shows that this is the technology. The downside behind all that is, unfortunately, the insurance companies are not saying that it's under the insurance policies, and they're looking into it. It's going to get there. It's a matter of time, but at least for right now, it's going to have to be not part of the insurance company. So that's really the only downside. But we're able to offer this, at a great opportunity for patients from all over, to go ahead and get it. And I've had patients from all over the country, West Coast, South, East Coast, North, even internationally, come and get injections, in the regions that they need to.
Dr. Hunter,
And then
one of the one of the
That's okay.
physicians on the call just asked, are you doing facet injections? Can you just walk me through the process and then what your post-op procedure is?
Yes. Yeah, that's a great question. So I think, from the standpoint of the facet injections, do a bone marrow aspirate, and then we concentrate it, And then we go ahead and use ultrasound to get to the facets. You can feel the facets. It's a something that from the experience of doing spine for 30 years now. We kind of feel where we're at, and then also use the ultrasound, which is important, and then inject some of the either the BMAC, bone marrow aspirate, or even PRP. You can even do PRP. People are doing PRP as well, where they're getting blood and then using the spinner and spinning it down, activating it, and then inject it in there. And then so it doesn't take all that much time. I think in the grand scheme of things, our clinic, the way we operate across the board, we do the procedure on day one. The next day, we contact them, see how they're doing. The next week, we contact them. We see them month one, month two, month three. They come back into our clinic, and we evaluate them, and then kind of go from there. And I think what we're seeing is that bar none, the bone marrow aspirate is a better concentration, obviously, than the PRP, and therefore they're going to do better. And this is not something where I tell patients they got to come and bone marrow aspirate every 6 months or every year. Like that. I don't do that at all. My goal is to do it one time and move on. And I think the literature and what we're seeing is that it'll go a few years with someone who takes a bone marrow aspirate. PRP, it might be about a year and a half. Will they need will they need it again? On here is patient testimonial Mike. Mike's been pain-free for a year or two. I've got another gentleman from the West Coast and in the state of Washington, where he came over, did the injection. I want to say that was back in 2015, and we performed the procedure, and able to continue without any problems from that end. So I think that's really helpful. Is there a time where you might need to booster somebody? It might be. It depends on how bad the situation is and how they're doing. But I'd like to let that go for a little bit of time before doing any kind of boosters.
Dr. Hunter, how many people do you think, if you remember again, do a lot of people fly in for this? Because in my experience, when I'm helping a clinic, people are flying to different places for this as if, it's not offered where they are. Do you have a lot of people flying in?
Here's the thing, and you've heard this for years, right? Tiger Woods made this very well known, where he went to Germany, and that's still ongoing. Kobe Bryant, went and had the same thing. Even there's another 49er, McCaffrey,
Christian
just recently went over.
McCaffrey.
Christian McCaffrey, near and dear to our hearts, from Charlotte. We donated him over to the 49ers, and rightfully so. Panthers aren't doing so good, but it's okay. But yeah, so there's a lot of people that have money, that are looking, and that fly out. I'd love to somehow get in front of the athletes. We certainly have done some athletes. We've done some minor league baseball players, college baseball players, pitchers, right? You worry about the Tommy John problem. They're throwing, they all of a sudden, maybe during their downtime, get an injection, get better through the recovery period, and then they can throw again and then not worry about the Tommy John thing. So I think that certainly has helped, with regards to things. So there's definitely, the technology is out there. Do they have to go to Europe to get it done? Germany, they must have a really good marketing, budget, I guess. But I think in the grand scheme of things, there are things that people can do here in the U.S. just as good, if not better. And I'm not sure what technology Germany is using, but I know that with selling here, it's bar none the best. And we get the patients better without needing to leave the country. And being Charlotte is an international airport, we have the ability to have patients come from all over.
Well, and regardless of where you lie and what you think about in this particular realm, it's just the idea that there are now a lot of people out there offering injections, and they're making a lot of false promises. Their advertising is very dangerous. And, sometimes they get FDA letters, but, when it comes down to, okay, who's actually doing the injection, neurosurgeon with 26 years is someone I'm probably going to vote for. Because a lot of the times when you're going, even chiropractors are offering injections, and it's not bone marrow. All right. They're using something that's bought off the shelves and kept in a fridge. And physicians aren't even injecting you. So I think people need to be very much aware of what's out there.
Yeah, I mean, to your point, when the FDA has now gone away, there were billion-dollar companies that had material off the shelf, and I made a real big decision right off the get-go that I didn't want to use off the shelf stuff. I wanted, in my mind, I'm thinking, look, my body wants to heal itself. How can I get the material that I need to heal it into the area? And so I was able to use this technology. So, in my knee, if I have a problem, I'm taking my material and putting it in my knee. If I'm taking a patient, I'm taking the patient's material of bone marrow, spinning it, and then putting it back into them. So it's their stuff into them. It's not off the shelf where through the years, and again, 28 years of practicing here, I think it's you see a lot, and even when we were doing cervical fusions, patients were getting diseases and things like that because it was coming from other people that weren't reputable, and certainly is scary. So it really always made in my mind to get it, and what's really exciting in my world, back when I first started, you mentioned that I was at the University of Wisconsin. When I was doing cervical fusions, the gold standard is to use the bone marrow in the hip, right? That's where the gold is to allow a fusion to occur. And my techniques that I was taught was to take a piece of that hip and put it into the neck and things like that. And I would do the surgery, and patients in the neck would have a great operation. They feel great. And the only complaint they have when, it was minus 15 in Madison, Wisconsin, was that their hip pain. Their hip was hurting them more than anything else. They like the operation. They feel better in their hands. Their neck is doing great, but boy, that hip really hurt. So we know that the material is there, and that's where, you guys, taught me that, hey, we can just go ahead and kind of aspirate and then use that material. And then with your spinners and with your technology, use the, most highest percentage of all the proteins and cytokines and enzymes to allow fusion to occur. So so I no longer have to take bone from the hip, which causes pain. I can just take a little needle in there, and that doesn't cause any type of pain. It's done in the office, reproducible and safe.
It definitely seems like a more logical jump of, rather than taking a piece of the hip, aspirating from the hip, than to fill the OR with all these expensive allografts and all these products that are really driving up the costs of surgery. A lot of people out there, I think, are just trying to make as much money as fast as possible, and it's very interesting, where we're going. I have a question from the same physician that asked about the facet injections. What are you doing for advertising? What was the beginning of your business like?
So, we were very fortunate to start the company in September, which was right when COVID started. So COVID first came out, in January of that year. So we were about 3 months before COVID came out. We started our company. So it was a hard first 12 months. But we were able to really work, and I can't say enough of the people that work with me. We were able to really set up our system, our foundation, and I think that's what's carried us from here on out. That we have a great solid foundation. We know what we want to do. We have protocols for everything. We have everything all set up. And so not only do we do, injections into the joints for stem cells, but we use that for hair, growth and facial things. So we do more at the regenerative center than just bone marrow aspirate or PRP injections. It's a whole medical technology where we do, like I said, hair growth and we have lasers and technology for tattoo removals and Botox injections. So it's a whole gamut, hormone replacement, weight loss. So the key is, to get patients better. However, we can help them to get better. There are times where they come into my clinic and to be quite honest, they're just too overweight. We can't do the surgery. We want to do the surgery, but they're, BMI, their body mass index, is so high that it's counterintuitive to do it because they will get a complication. So we've got to tell them, look, you've got to lose 100 pounds, 120 pounds. So we guide them over to the clinic or any clinic. It doesn't really matter as long as they can get some kind of weight loss. And then from there, we can then kind of help them. So if there's a way to somehow improve, the patients overall, I think that's where we need to be, right? And I think it's better to be preventative, right? I mean, I think in the grand scheme of things, as a spine surgeon, it seems like we're kind of doing things, reactive because they've had this problem, they've developed this, we now have to kind of structure it back in together. But if there's a way that we can somehow prevent this stuff, if they can weight loss and then get into an exercise regimen, they do physical therapy and they're strengthening their muscles and their bones and things like that, they might not need the surgery in their spine because the core muscles might be strong enough to where it's going to improve everything so that they don't even develop into a problem. So that would be the ultimate goal.
Absolutely. I get 2 PRP injections a year in my knee, and my knee never even really hurt. I had trauma when I was in my early 20s, and I know what I know, and I just said, okay, we're going to start preventing this. This is more for me. I'm just curious, I've gotten to speak to you so many times, but do you have any personal success stories with a patient, especially from an injection that you remember that you're like, wow, like we really helped that person, or you remember how they were walking when they came in and then, a couple months later, just out of curiosity?
Yeah, there was one guy. There's a couple stories actually. One guy was a worker at a local company that was doing a lot of heavy lifting. He developed a problem, and then he just kind of spiraled down. He got fired from his job. Gained 40 pounds. Had so much back pain, and he was one of those patients where he didn't really need an operation, but he couldn't live the way that he was living. And so I actually offered him, and he had a problem with degenerative disc disease. We hear that all the time. Degenerative disc disease, a bulging disc, not bad enough for a surgery, but certainly a problem. And I was able to, inject, into his disc space some bone marrow aspirate. And it was something that we did, and we told him, it's going to work, and probably inject about 1 to 2 cc, so it's not really a lot, but it'll allow that area to kind of heal up. And then we saw him, on a regular schedule, and then the 4th month or the 6th month, he lost 100 pounds. He looked great. He has a job now as a security guard, doing things. So he was 36 years old, or, at the time he was 36 years old. So this literally changed his life, and he was crying, and he gave me a hug and wanted to take a picture and things like that, just to kind of do, to show that, this really, really helped him. And it sort of makes us feel good, right? I mean, we're into it to try to help the patients. I mean, I'm still old enough to where I still give my cell number to my patients. And so when we're doing these injections, I said, look, I know that, it's at night and on the weekends, that's when you all have the problem. I said, look, text me. I won't know your number, but tell me who you are, and I'll get back to you. If I'm in the operating room, my nurses will get back to you. Wherever I am, we'll get an answer to try to help you. I mean, I certainly care about the patient's well-being. And I think going back to one of the questions about what kind of advertising you're doing, we try to do all the different advertises, but I think really, if you just take care of the patient, I think the patient's going to be your best advertisement, and more of a grassroots kind of, advertisement. The other story is another personal story. I mean, I still play racquetball. My racquetball buddy, hurt his leg and hurt his knee, and he was telling me I did something with the knees or something I can do, and so talked to him about it. Did the injection, and he felt great. And we went back. He wanted to go back a little earlier, and I had to hold him back a little bit. But he felt really good, and to this day we're playing racquetball still. So yeah, I think those are good. I think another story is a coach, who is having a hard time as a basketball coach, right? In AAU and high school and stuff like that. And it was hard for him to walk the courts and things. So able to do his injection. And next thing I know, he's telling me that he's, running up the stairs in his house, and his son was shocked because he heard all this noise, didn't know what the hell it was. And next thing you know, it's his dad running up the steps, which he had never seen before. So I think, being able to change lives, I think is important. If we can do it from a non-surgical standpoint, if we do it from a regenerative center, injection standpoint, might be better off in the long run.
Absolutely. And I know that there's a lot of people out there that they're on the fence about it. I firmly believe about it in it as a preventative measure. I mean, any early onset pain, if you just let it go, is really just going to, matriculate into something worse. And you're going to go down that road of, all right, well, my back hurts, but no, now my knee hurts, and now my feet hurt because I'm walking badly, and it's just, So overall wellness is important. I know that's what you preach at Mark. So it's fun working with you. The man definitely works 24/7. I know this because we were on a call together last night at 9:30. So it never ends. You are very impressive. So again, the questions were rolling in. If anybody doesn't have anything else, we can end a few minutes early. Thank you so much for everyone's attention. Dr. Hunter, thank you for your time tonight. It's always a privilege to have you. Thank you for working with us for so long. Really, thank you from the bottom of my heart. You've just been one of my the most fun webinars we've done, in my opinion. So thank you.
Thanks, Greg. That was very kind of you. Thanks, everyone.
All right, y'all have a good night.
All right.